Bismillahirrahmanirrahim. Today we will have case quiz number 14. Case data: 32 years old female, complaining of 2 months history of weight loss, abdominal cramps, and loose stool. 2 months history of weight loss, abdominal crampings, and loose stool, with malodorous stool, but no blood associated with bowel movements. Although good appetite, she had lost 3.2 kg over 2 months. The patient had 8 years history of diffuse cutaneous systemic sclerosis. So the patient is known systemic sclerosis diffuse type for 8 years, but the recent complaint is 2 months only. On physical examination, temperature is within normal. Blood pressure slightly increased, 146 over 92. Pulse rate, tachycardia, 94 beat per minute. Respiratory rate within normal, 16 per minute. BMI 19, body mass index 19. Cardiopulmonary examination is normal. The abdomen is soft and non-tender with normal bowel sounds. Patient had diffuse skin thickening of the face, anterior chest, and distal extremities, with sclerodactyly, multiple healed digital bits, with no rash. Muscle strength and reflexes are normal. Investigations of this case showed hemoglobin anemia with 8.9 gram per deciliter, hematocrit value 30%, white BCs increased 13.6, albumin decreased 2.6, ALT within normal 14, and AST 17 also within normal. Total bilirubin 0.8 within normal, lipase normal, urine analysis normal, ESR high 79, sorry, and CRB high also. So, which of the following is the most appropriate diagnostic test to perform next? Colonoscopy or CT abdomen and pelvis with contrast, or endoscopic retrograde cholangiopancreatography, what is known as ERCP, or glucose hydrogen breath test? Which of the following test is the most appropriate test for this case to do next? Take a breath and answer with before you can see the answer here. You can stop the video here and search, and the answer is glucose hydrogen breath test. Why? The educational objective here is diagnosis of bacterial overgrowth syndrome due to systemic sclerosis associated intestinal disease. To diagnose bacterial overgrowth syndrome due to systemic sclerosis associated intestinal disease. In patients with systemic sclerosis, malabsorption due to bacterial overgrowth is evaluated by obtaining a glucose hydrogen breath test. A glucose hydrogen breath test is indicated in this case. This patient had an 8 years history of diffuse cutaneous systemic sclerosis and now present with weight loss, abdominal cramps, and loose stool. She is at high risk for developing malabsorption from bacterial overgrowth, which is also known as blind loop syndrome, due to altered peristalsis caused by fibrosis associated with her underlying disease, I mean diffuse systemic sclerosis. She has unexplained weight loss as well as loose stool without any increase in symptoms of dysphagia, nausea, or vomiting. The most appropriate study for her evaluation in this time is glucose hydrogen breath test. The gold standard for the detection of bacterial overgrowth is in small bowel aspiration, but this study is not frequently performed because it is invasive. So the gold standard is to take aspirate from the small bowel, but this is very invasive. So the glucose hydrogen breath test is the suitable for this case. By comparison, the glucose hydrogen breath test is non-invasive and had a high sensitivity and high specificity. Barium study may also be done to confirm these findings, but obtaining a CT scan for this patient is unnecessary and costly. MRI may also be useful in the future for assessment of disease and exclusion of other pathologies. She doesn't have bloody bowel movements or colitis, and performing a colonoscopy is unlikely to lead to a correct diagnosis because the primary pathology is in the small bowel rather than the colon. So, if we have colonoscopy, we we may find normal colon. Endoscopic retrograde cholangiopancreatography (ERCP) is the diagnostic test of choice for suspected pancreatic or extrahepatic biliary tract pathology, but not bacterial overgrowth. So this is suitable for extra gut or extra يعني associated pathologies of the GIT uh, regarding the pancreas or the liver rather than the gut itself. She has no evidence of biliary tract blockage or pancreatic disease, so ERCP is not suitable. And finally, thank you very much for your attendance, and we will meet you tomorrow or the next future with case quiz number 15. Wassalamu alaikum wa rahmatullahi wa barakatuh.